healthcare is such an issue. Our community is one car accident away from being homeless. It touches me beyond belief of how healthcare touches everybody. Putting money back into people's pockets, it's helping other people. That's what we're doing as a community.
Welcome to the Masters of Business podcast with Daniel Beer.
One thing that most everybody agrees with, regardless of where you are, where you sit, side of the aisle, etc., it's that healthcare is broken, has been for a long time. And this is going to be an impact-making episode here for your business. The one thing that sometimes can be the difference between being in business or not at all is the expenses of healthcare and the weight of that on the business. And there's the big world that everybody knows about, everybody plays in, but most don't really know how the game works because there's an entirely different space, and it could be the difference between profit and loss. I have Nellie Nekouie on today. Welcome, Nellie, to the podcast. You're an industry expert. You held a high position at UnitedHealth. You worked at Anthem, all the traditional healthcare. You can round out the intro, anything you think we need to know about that background. And now you're solving healthcare in a very different way. So this is a really cool opportunity for us to speak to, well, not just all the business owners that are here, because they have businesses they have to take care of, but also every one of us is a human being that needs this and needs to solve this once and for all. So welcome. And let's just jump in. What did you do at Big Healthcare? And why'd you end up making a shift? What are the issues that you saw there?
First of all, thank you so much for having me. And yes, healthcare is truly a systemic problem. My background, been in healthcare for over 16 years. I was Arizona State Director, leading clinical and behavioral health teams to transition our homeless population in housing to get them self-sufficient back to the community, amongst other things I've done. Optum, pharmacy benefits management, healthcare technology company, built a product end to end and sold to payers. So seeing different sides of the spectrum when we're dealing with our homeless population, as you can imagine, we're looking at total cost of care from a healthcare perspective and not siloed in one part of that whole person. So, healthcare, I definitely saw how broken our healthcare system is from a different perspective. That's why you'll hear the conviction and passion on my voice and how important healthcare really is. I say we're all, believe it or not, most of our community is one car accident away from being homeless. So, I fought health equity at a legislative level, and about 2 years ago, I got introduced to Impact Health. So a shift in truly understanding health sharing, which I had never even heard about. So I'm so grateful and honored now. What I do is go from city to city, educating our communities on an alternative option other than traditional health insurance called Impact Health Sharing.
So what is there's this health sharing thing that some of us have started to hear about, but most of us don't understand. And you made the change yourself, right? Like you actually, like your story is one where you needed to solve this for yourself once you went into your own business, left United Health, you became a consultant, and you had to sort out, oh gosh, how do I provide myself with healthcare, not to mention my employees. So take us into that. And why did you not go with what you knew your entire life?
Great question. Appreciate you asking that question because most don't. I had never even heard of health sharing. Health sharing's been around for over 40 years. It started in churches, essentially a community helping each other in need. And about 6 years ago, government stepped in and changed the law from being religious based to ethic based. So come one, come all. I was introduced to it 2 years ago, having my own company. Like 87% of the population, I never met my deductible, never really had to use the healthcare system myself, although I know how broken it is. Never had surgery, never had any health issues. But actually, organizations like Chick-fil-A, Whole Foods, Walmart, just to name a few, Coca-Cola, have been using health sharing for decades because of the cost savings. Now I was going from $650 a month just for myself to $268 a month. That's why I made the shift. So it just made sense.
So what were you at before you made the change?
Over $650 a month just for myself.
All right. So one thing about this podcast for sure is like we'll always dig in, ask the hard questions, and so we don't do any fluff. You go from 600 and something dollars to 200 and something dollars just to insure yourself. But obviously, it's the natural question is what was insured previously that maybe wasn't anymore? What was the change in coverage? What were the inconveniences? What was the difference in what you were paying for?
So I love that question because when I talk about impact health sharing and the differences, traditional health insurance, I actually had a $10,000 deductible. So in traditional health insurance, you got to cough up that deductible, pay cash right up front until the co-insurance kicks in, and then there's a max out of pocket. Right? So, and then health sharing, it's actually a non for profit. So, what the huge difference I saw and didn't understand until about a year and a half ago, I had the unforeseen opportunity being on the patient end and had emergency surgery, not fun. 6 incisions later, Hoag Hospital, Newport Beach, California. But I learned 2 things. 1, how easy it was to use. Second, when I saw my bills. So traditional health insurance, as I mentioned, 87% of people don't even meet that deductible. You got to cough up that deductible up front. Now, I had a $10,000 deductible when I was with the traditional health insurance, with Impact a $2,500 deductible. Because it's a non for profit, the facility bill's impact on the back end. Now, we don't have to pay dividends or investors like the for profit insurance companies. So, Impact then does something called reference based repricing and average about 72 to 80% savings up front on that entirety of the bill. And then it hits that deductible. That's where I was this just doesn't happen in traditional health insurance. I had one of my bills, for example, over a $36,000 bill. It was repriced to $9,400. Just to show you a little bit of that margin or communicate a little bit of that margin. Then after so that $9,400 reprice bill, now I have a $2,500 deductible. So once I meet that, and then it's a 1090 share up to a max of 5,000. So I'm only responsible for 10% of that reprice bill. That's the huge differentiator up front, amongst other things I can definitely dig into with Impact, but a huge differentiator. The other thing is Impact also offers $150 a month, $1,800 a year towards that $2,500 deductible, anything preventative or holistic, including gym memberships, supplements, vitamins, holistic, essential oils, massages, incentivizing to stay healthy. And why I mention that is because essentially your deductible is lowered to $700 for the entirety of the family.
So, any conversation that I've ever had around health sharing, and this might be the third or so conversation, but all people I really, really respect, people that you know, know of are the highest integrity and just the kind of people you'd want to hang around, be around. They tell a similar story in terms of like all the benefits, all the savings, et cetera, et cetera. So then why? Like the natural question is why isn't the whole world on it? Right? Like why is traditional healthcare or insurance, okay, why is traditional insurance still the path that most pretty smart corporations take, that most people take? What's getting in the way?
Wow, great question. So traditional health insurance has been around for a long time, right? It's for profit. From my own experience, health sharing's been around a long time, but historically it was religious based. That's why I hadn't heard of it. So you had to be a certain religion, certain stipulations around what's covered, what's not covered. Essentially, it was a pot of money helping a community ministry, helping each other in need. Now, when the law changed, which a lot of people don't know, about 6 years ago, then it was come one, come all. Now, when you say come one, come all, now it's ethic based. So that's why the differentiator between traditional health insurance or health sharing, rather, you had to be a certain religion, where now Impact, a couple different things that are inclusive is one, it's not marketed like traditional health insurance companies. That's what, just like evolution of anything, that's what people know, are familiar with traditional health insurance. Now, health sharing has now become more common. There's over 1.7 million people and rising that are with health sharing. And it's definitely growing and growing fast because the top of conversation right now is healthcare costs, right? And the barriers in in the way from a network perspective, and I can talk about this for a while, right? Go digging into the different conversations around that. But what I found is the marketing piece, right? Is the marketing piece, it's not marketed like traditional health insurance. And now, because it's ethic based, it's come one, come all. Impact, for example, is attached to a direct selling marketing agency versus traditionally where traditional marketing of a traditional
So
health
you've had a
insurance.
marketing issue.
Yeah, exactly. This is how we're spread is word of mouth. And I literally go from
Right.
community to community sharing it within our communities because I didn't even know about health sharing, and I've been in healthcare for 16 years.
So you've built a business around this now. How many salespeople do you have that work in your organization?
My organization alone is 2,200 and
So you
counting,
have 2,200 salespeople, and spread across what geography?
nationally
All
in
right,
the
so
US.
let's back off here because this is Masters of Business, and people want to know, how do I grow my business? How have you gone about growing a sales force of 2,200 people? We have doctors on here. We have, we have people with painting companies listening. We have people from every industry you could think of that would love to do the same. So, how have you built a 2,200 person workforce or sales force in what period of time?
2 years, New Year's Eve.
So over the course of 2 years, 2,200 people across the country that roll up to you. Great. How do you do that? Because I've been at my business now for 20 years this June, and I'll have 50 salespeople in my direct selling team, by 20 years later, right? Like here selling homes with me in San Diego. So how and I have a national team that's different, it's separate, it's, part of my brokerage platform. That's in excess of now 14,000 people, but I've built this all over 20 years. How have you done 2,200 people in 2 years? What's the approach? What have you learned? What do people need to know about basically the questions about building teams, right? That's what you've become really, really good at.
Yeah, I love this question. I've actually never been asked it this way. And because healthcare is such a problem, first of all, you'll hear it in my voice conviction. I've seen the nasty of the nasty when we're talking about the healthcare system, our homeless population. So that side of it, I mean, it touches me beyond belief of how healthcare touches everybody. In one way, shape, or another, we have some sort of story attached to us or someone that we know. So going back to your question is how has it grown so fast? Because everybody's incentivized to share it. If I didn't know about it, if you don't know about it, how many other people don't know about it? And this, I call it a health share, wealth share opportunity, to be honest. Why? Because it's putting money back into people's pockets. It's helping other people. And that's what we're doing as a community. And that's why I believe that it hasn't grown fast enough because healthcare is such an issue and it touches everybody's life. But I mean, business owners, you said business owners are on here. Business owners just went through open enrollment. We don't have open enrollment, and they felt the pain of double digit increases. So, what do business owners know? Other business owners who'd love to put money back into their pockets, help their employees, because guess what? Because the costs have gone up so much, is that you find that employees don't opt into their own health care of business owners. It's gone up. Not only is it touching and hurting the pain of the business owner, but also employees aren't opting in. So what happens? God forbid something happens to an employee. Again, one car accident away. At least they have something in place. So sharing it with not only employees, colleagues, other friends and business owners, and you're incentivized by helping your community. That's where I truly the approach I believe is what's changed in our organization, is that really the approach of helping other people as well as helping yourself.
So you're saying that the product itself, like you started off with your first company or person or whoever it was that you helped solve their own healthcare issue, but there's a mechanism in place within the company that should they enjoy what they're getting, if they say, "Hey, this is a lot better than my previous insurance," and if they share that with a friend, with a company, with whoever they might share it with, they're incentivized to do so. They get a referral fee, so to speak. So then that's kind of created an organic enrollment of that's turned into this 2,200 person sales force for you.
Absolutely.
Well, so there's other people I would imagine that are also with at Impact or other health sharing organizations that haven't had your results. So still there's something you're doing, some business principle that you're living by, like some superpower you have to actually build the way that you have. And at the end of the day, you care. You made that very, very clear. But so does Betty, Bob, and Sue. But they don't have 2,200 person sales force the way you do. So what do you think that is? What are some what are some useful nuggets that people could use if they are wanting to be intentional the way that you've been and try to duplicate, if not even surpass your result?
And that's a great point is a system. Having a system in place is what's really helped us is educating. Everybody's busy. As a business owner, you're busy. So being able to assist the business owner in educating their employees, their colleagues, the people they're referring, we have a system, we have calls set in place for me to help educate. And that's exactly what I do is going from community to community educating because what find is that there's a lack of education of what not only the product is, how to share it, and how to use it. So once you have belief, I used it myself, had the unforeseen opportunity, saw my bills and go, "What is this? I need to understand what this is because it's solving for a bigger problem." If we're all the number one reason for bankruptcy is medical bills, believe it or not, right? And so when I've seen it on the other side, and if I was with traditional health insurance, I would have been out over 20, $30,000, but because of impact, maybe out 2,000. So I dug deeper, right? And because of that belief, now here we have a system to be able to help educate. What I found is the biggest gap is the education piece. We know it's good. We're on it. However, why is it not growing more? More people need to know about this. So, really taking advantage of larger audiences and maybe it's another staff meeting or another appropriate meeting where it goes hand in glove with other because healthcare touches everybody. It goes hand in glove with every single, you can customize it with every single business, with every single person, individuals, families, business owners. Everything you do, healthcare touches everybody. So customizing that approach to be able to take advantage of those bigger audiences and being able to share it in those specific meetings, those settings, those that's what's really scaled. So that's a really good point. What I've identified and did the same thing in the United Healthcare is identify the bigger audiences and being able to customize and approach and educate with those bigger audiences because you already have those bigger audiences in place. They're already in front of you. Use that audience, take 8 minutes and share impact. Something that may they just educate them. They may not be a good fit, but at least now they're aware of it and can share it with other people.
Now, is Impact a wrong fit for anybody? Is there anyone that just, it's just not the right solution for?
Yeah, it's not for everybody. It bridges a huge gap. There's a lot of insurance brokers in our organization offering it, bridging a gap. Why? Because we don't deny anybody. It is ethic based. It's based on two things: birthday of the oldest person in the household, how many people in the household, one, two, or three plus. So yes, any household above three is going to have a huge savings because that premium doesn't go higher. Now, it we do have a 36-month clause, meaning anybody going through any kind of symptoms, treatment in the last specifically diagnosed or treating anything in the last 36 months, it may not be a good fit because we still help with the repricing of that bill, reference-based repricing, still get the benefits of the pharmacy benefits. However, after that bill is repriced, it's not a shareable expense by the community. The patient is responsible for that. That's how it's sustainable as well, as you can imagine. But anything prior to that 36 months is non existent. So there's a huge differentiator between traditional health insurance and impact because of that. But yes, it may not be a good fit for someone going through chronic treatment right now. And that may be a case by case scenario where impact can kind of dive into that PHI, personal health
So they're
information.
already in chronic treatment. What
Correct.
if they're not already in it, but while insured through impact, develop something, right? Develop something, anything from the worst things out there, cancer to whatever else it might be, Parkinson's.
Yeah, unfortunately, there's been, I mean, my own case, right? I had emergency surgery. Now, it was an appendicitis and ovarian cyst that had burst and internally bleeding, nothing previous. No, but both very traumatic events that happened both at one time, unforeseen, but everything's covered end to end. And God forbid it's happened where people haven't had health insurance. Now they're able to be insured by a health sharing, meaning impact, and they've gone through their preventative tests and identified something like unforeseen, like cancer, and now going through treatment. Everything's covered end to end. Absolutely. And you're not denied.
Really, really good. So, okay. So that's really interesting. So this is called health sharing. And let's just say, like, brass tacks. Let's imagine. So I'm on traditional insurance. How would I sort out what I know what I'm paying now versus what I'm going to pay? Is just how common. You told us one story. How common are those stories? You told us your own story. But how would I go about sorting out what the savings I could have, right? Because if I can save, $700 or $800 or $2,000 in a month, right? I've got a family of 5. Um, I would wanna know, how does someone go about knowing?
Very easy to get a quote. It takes about 2 minutes. Again, it's based on how many people in the family and the birthday of the oldest person in the family. That's it. Average individual is anywhere as low as $73 a month. Average is about 280. A family above three or more, is average around 600. So that just gives you an idea, and the deductible of 2,500 is the lowest deductible. There's 4 options just like traditional health insurance: 2,500, 5,000, 7,500, and 10,000. Once that's met, it's a 1090 share for a certain premium a month. Now, though at the lowest deductible, that's for the entirety of the family, regardless of how many people in the family, versus per individual family member in traditional health insurance. So some things you want to look at, even if it's a W-2 employee, I'll show you and put impact next to it, because if you look at your deductible per person in the family, your max out of pocket, and your monthly, I mean, there's 3 different things you want to look at. That deductible alone, you're saving thousands of dollars because typically it's per individual person and it's a high deductible. So you're saving somewhere, whether with the premium monthly, or God forbid, people don't realize what they have. A lot of times you have 2 weeks to choose an insurance plan, and you're at the last minute, you're under stress and duress, you're choosing something and don't know what's covered until unfortunately something catastrophic happens and you realize what actually you do have or don't have because of what happened. Because typically you're not using it unless, God forbid, something catastrophic happens. So some things to look at. I mean, I literally, you're healthy or fairly healthy. I mean, it's definitely something you want to look at, but I can put anything next to impact, and that's how confident I am. But like I said, it's not for everybody, but it's maybe a case by case. But as a family, you want to look at that deductible as a huge piece of it, but also there's so many other benefits that we haven't even gotten into. Like, we don't have a network. We're recognized as commercial insurance. You can go to any doctor, any provider, Google the best of the best. So the freedom of choice is back into your hands, which you don't have that in traditional health insurance.
So, Nelly, let's get into some fun things here, just because people like you that build such big organizations, big businesses, I'd like to know a few things about you. One is, I always like to know, because there's so many different opportunities, even within the space that you're working, right? Like, you can go after, there's so many different ways you could build your business, and there's so many opportunities that show up along the way, and people pitch you on this or on that. How do you work through the difference between when you know that you're looking at an opportunity versus when you're looking at a distraction? What framework do you use for that? Is it just gut? Do you work it, or do you filter it through some kind of criteria to understand where to place your time? Because, like, I think someone like yourself, is only limited by time and how we can try to duplicate time, how we could try to multiply time. Like, not all of us are working with a 24-hour day. Some of us actually have far more than that in our day. It's a bigger discussion. How do you create that for yourself?
Well, there's a couple questions there. One, how am I aligned with everything I'm doing? It always goes back to, one, yeah, I love the fact that you brought up gut. Yes, it is gut because if it's aligned with my passion, if it's aligned with helping, you can customize healthcare in every specific niche because it touches everybody. So impact can be customizable in different markets. I mean, I've, yes, heard all sorts of markets. Is it aligned with my morals, my values, and where we're headed in healthcare? Because I believe that I was fighting health equity at a legislative level. It's a solution that we haven't had and finally do have. So, to going back to your question, is time. How do I stay aligned with what's and focusing on? Is one, creating a system. How do we bring more people to share it with more people? And aligned with the leaders that are growing across the world in the different spaces to be able to share it with them at the same time, have a place for everybody to share it with their networks. And it's really created that duplicatable system to be able to have both, one for the many
Hmm.
and one for the few.
So good. So good. What are you reading right now? Are you a reader?
That's a great question. I have
Not
so
to
many.
be a reader. You may.
I love, no, Atomic Habits. I mean, I listen to Audible books all the time. I am.
What's recent that jumps out at you, right? That you've been reading or listened to?
I literally just got, I don't know if you're familiar with him, Rene Rodriguez. I got the opportunity because of my organization that put me in front of a incredible group in Georgia, Amplify Your Influence. He was incredible, and I'm actually speaking on a large stage next week in Dallas, and it really resonated with me. So that's what have literally in front of me because it definitely impacted me being in front of him, and that's the blessing that I do have to, per what you just mentioned too, is how do you align your time, and it's the many and the few, and then I get that I never imagined having the opportunity to meet with such incredible people around the world, and one that just fell in my lap, and I don't believe in accidents or coincidences, and so that's the book today that's in front of me.
He's amazing. He's just awesome. He's somebody that we need to have on this podcast. He and I have been going back and forth trying to find a time, and we absolutely will. So it's really, really good. And here's what I've done. I've This is a very different type of episode than most that we do here, but this is just one where it's interesting because you've actually built this giant sales team. And a lot of us want to understand, get tidbits on how we can do that. And at the same time, we have a healthcare issue that we need to solve for ourselves and for our businesses. And felt like this would be really high value for the audience. If somebody wants to connect with you very directly to understand their picture or how they could even help, how they could amplify your message or whatever in whatever way they see themselves being able to participate with what you're doing and to just explore it, I've set up connectwithnellie.com. Connect with Nellie. Nellie is Nellie. If you're watching this on YouTube, I'll have the link in there. But if you just go to connectwithnellie.com, you'll be able to jump right into her calendar. She'll have spots open and available for you to just jump in, grab a conversation, see if there's whatever amount of savings. I mean, we're not talking $5, $10. It's been, these conversations have been mostly $500, $1,000, $2,000, $3,000 a month in savings. And also, there's people like in my own case where I want to roll this out to my whole organization. It's the coolest thing because I'm going to save them. It benefits them, especially, my people are 1099s, though this is absolutely something that W-2 companies are doing as well, but it benefits them. And then as a company owner, well, it benefits my 1099s, but I also have W-2s. And as a W-2 payor can I replace that with something that also saves the company money and we can move salaries toward bonuses, toward profit. And that's fine too, by the way, right? But toward profit, toward bonuses, toward new salaries, toward raises, toward future needs, or just insulating the company for cash needs down the line in unforeseen times. And so all that's really, really beneficial. Nelly, you're awesome. I appreciate it. I look forward to getting to know you more, meeting up with you again, and we'll continue the conversation because this is just one of those things. It's like every now and then, it seems like every 3, 4, 5 years, you learn something like you go like, "What? How is this not the normal?" Right? Like, how is the thing we've been doing normal and not like, and this is one of those. So thank you so much for jumping on Masters of Business, and you've been awesome
Thank you so much for having me. Appreciate you sharing.
for sure.